this video, we aim to demonstrate our new and effective innovation sewing needle microcapsulotome to avert Argentinian flag sign during capsular access in patients with intimacy. In this video, we aim
Please, what happened? Volume, please. Yeah, don't start the timer till you get volume.
to demonstrate our new and effective innovation. Greetings, everyone. In this video, we aim to demonstrate our new and effective innovation sewing needle microcapsulotome to
Increase the volume, please.
flag sign during capsular access in patients with intumescent pearly white mature cataracts. Argentinian flag sign is a complication during capsular access in intumescent white cataracts, which typically arises instantly after initial prick by sharp hypodermic needle. It is known that raised intralenticule pressure is responsible for propagation of the initial prick into a radial tear. To counter this, several techniques, including a small needle aspiration technique, have been described, but the peripheral extension of the capsular tear, as is still seen instantly after pricking the capsule with hypodermic needle even before the aspiration of cortex. So, other factor, that is a linear cut configuration with discontinuous open edges with the needle, are responsible too. The disruptive forces act along the axis of the linear curve, so the tear always extends radially along the open margins of the cut, but never perpendicular. So we came up with a hypothesis that if we are able to manually create an opening in the anterior capsule with a round regular configuration like a capsulotomy with round continuous circular edge without any discontinuity, hence do not tear away with a sudden outburst of the intralenticular fluid. To prick the capsule, we developed a novel instrument, sewing needle microcapsulotome, with round pointed tip like a sewing needle system. Tip is approximately 0.75 mm in length, 0.6 mm in diameter, and angled at 90 degrees to the distal shaft. On puncturing the capsule, it creates a round hole opening with a smooth margins, unlike the linear cut produced by the sharp needle. After proper visco in the AC through the main incision, the sewing needle microcapsulotome is inserted. Tip of the needle is placed vertically over the center of the capsule. Tip is then moved downward to penetrate through the taut anterior capsule. Round pointed tip creates a round opening with a smooth margins at the center of the capsule. Pressurized intralenticular fluid gushes out as a volcanic eruption through the hole, which decreases the intralenticular pressure and helps in the decompression of the capsular bag. Evacuation of the intralenticular fluid, including the posterior compartment fluid, is achieved by tapping the capsule posteriorly. Again, cohesive visco is pushed in AC to flatten the anterior capsule, and intended 5 to 5.5 mm of capsular access is initiated after tearing the central hole using a Rexis forceps and easily completed without the risk of peripheral extension. To conclude, sewing needle microcapsulotome with circular round hole puncture of the anterior capsule along with pressure decompression is the simplest of technique which enables us to successfully prevent Argentinian flag sign. Sewing needle microcapsulotome is simple yet highly effective novel tool and is an ideal device to open up dense anterior capsule to adequately decompress the bag prior to the initiation of the capsular access. Thank you.
Yeah, Dr. MORYA, any clinical trials for this?
Yeah, we are doing it. We are comparing it with the this simple needle aspiration. So right now we have done 23 cases in both the groups. So there is no extension in this sewing needle microcapsulotomy, but 2 cases in the small needle aspiration were noted. But the sample size is very large, so it's too early to say.
Any other trial with any other method of
yeah, we can do with Zapto or with FLAC also.
And
To check the cost effectiveness of this technique, because it's hardly costing anything.
is it commercially available?
Yeah, it is available with Epsilon.
And have you applied for the trade, this mark patent?
Yeah, it's under pending.
Pending.
Yeah,
Right.
it's pending.
Yeah. Thank you.
Thank you.
Thank you so
Very
much,
good.
Dr. Morya.
Thank you so much.